welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of Kevin MD. Today on the show, we have Jasminka Criley. She is a hospitalist and she wrote the Kevin MD article, The Emotional Side of Being a Doctor During the COVID-19 Pandemic. Jasminka, welcome to the show.
Thank you, Kevin. Thank you for having me on your podcast. Thank you also for all the work that you do and for giving a voice to all of us physicians. It is great to be here.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yes, sure. I would be happy to. So I am an internist, hospitalist. I'm also an associate clinical professor of medicine at UCLA School of Medicine. I've been teaching there for over 13 years. I wanted to be a doctor since 9. I went into medicine, finished my medical school in Croatia. I did research at Hopkins and internal medicine residency training at Vanderbilt. I'm very grateful for amazing education and training that I got. After residency, I went into hospital medicine with a plan to do it for about a year or two, but I loved it and have been doing it for over 20 years. Over the past year, I had the honor and privilege to take care of many patients. In addition to clinical roles, I also had lots of leadership and administrative duties as well. I was a director of inpatient teaching services, hospitalist program, research, medical clerkships, and associate and residency program director. So very wonderful experiences along the way. I worked in both private practice as well as in the academic settings.
All right, let's transition into your Kevin MD article, The Emotional Side of Being a Doctor During the COVID-19 Pandemic. Now, for those who haven't read the article, can you just walk my audience through it and share the story of why you decided to write it?
That article was one of those mysterious things. I did not plan to write it. It came out naturally. I love writing and I wish I have more time to write more things I want to write about. But I didn't necessarily plan to write this one. It just came out and, I didn't know why. Now, thinking about it, I think it was a result of lots of things accumulating over the months and then preparing me to write the article. So really kind of what was happening, just to give you some background at the time, globally, we were in the midst of the pandemics. I was in contact with my colleagues all around the country. Some of them had absolutely horrific time taking care of COVID-19 patients. Some of them didn't have enough PPEs. They were concerned for their own safety. There were lots of people dying, some prematurely and unnecessarily so, actually most of them. So that was really, really sad. Locally, some of my colleagues, more than the others, were concerned about their and their family safety, and also about initially lack of the PPEs. I do have to say that our local community has been wonderful. People were very supportive. They were offering to make masks and face shields. Even one of our sons got a hold of a pattern that people in the community were making for the face shields at home. So he ordered all the parts. He assembled them all together. Some of the parts took weeks to arrive, but after he assembled them, he delivered them to the local healthcare workers and also to teachers. He even shipped some to Texas to one of his former science teachers who moved to Texas. So, that was kind of some of the background. In terms of work in a hospital, as we all know, the procedures and routines changed. It took much more to start to work and also to end your work because we needed to make patients and healthcare workers safe and also each other safe as well. So it took extra time. At home, I created a hotspot for everything hospital related to make sure to make my family safe. One of our colleagues unfortunately got COVID early on. And that was unfortunate, but also scary for everybody and made everybody much more vigilant about the procedures. Another thing that kind of affected me too is learning about Dr. Lorna Breen's death. A colleague of mine trained with Dr. Breen, and that story was so tragic. She died from suicide. So when that happened, my friend posted her heart was as big as her smile. Her smile was as big as her heart. That was so heartbreaking. I felt her pain deeply. I didn't know her personally, but my heart went out to her friends and to her family. So that was just one more example of MDs burning out and not seeing any light at the end of the very dark tunnel. So that was some of the background that led to the evening shift, which inspired the piece I wrote about. So on that evening shift, what happened is I had 3 ER pages for patients who were short of breath, and they all needed ICU admissions, and they all needed to be intubated shortly thereafter. I had other admissions too, to PCU and other floors, but 3 admissions, 3 sick patients in a short period of time that evening was just way too much. In addition to people being sick, I was also being asked lots of questions from both patients, but also the family. Patients were asking me things like, when can I go home? Or can I leave tomorrow? And I was trying to be cautiously optimistic, but I was also realistic, knowing that things might get worse before they get better. And that is exactly what happened. Also from the family side, family were asking questions about letting them stay with their loved ones. And I wish I could do that, but I couldn't. We had to keep everybody safe, and it just wasn't safe for anybody. So, my ability to empathize with patients and their loved ones and understand their fear and understand their concerns, and knowing that they were very afraid of the unknown, it was all real. So, all this being put together, my patients, rapid deteriorations, questions, family requests, and, concerns, all of this kind of accumulated and made things very hard. Another thing that I have to mention is that one of my patients was a healthcare worker. She worked in a nursing home, and this is where she contracted COVID. As you know, at the time, more than 1,700 healthcare workers died of COVID. Some of them died because they didn't have enough PPEs. And that is very sad, especially in this great country that we have here. So, that was kind of really sad. Another thing is I wanted to also mention is importance of the empathy and the compassion. Empathy and compassion are great clinical skills. I have lots of empathy and compassion. That is who I am. This is how I practice medicine. And I think it makes me a better doctor. Both of those are emotional connections to being a great healer. But as I wrote in my article, empathy and compassion can weigh heavily on physicians, especially at these difficult times. When we feel we are connected to everything, we might feel that we are responsible for everything. And this burden of the pandemic and this type of work that we carry on our shoulders and trying to help everybody, it can be overwhelming, and it could crush us if we don't know how to manage that. So being in the shoes of somebody else and understanding what they're going through, it's great, but it's also very important that we know how to extract ourselves out from it so we don't get crushed or trapped in it. That is another very interesting aspect. And another thing, Kevin, that I wanted to share is also I was very puzzled by emotional impact that particular evening had on me. I was thinking, I didn't know why. Only after I slept on it and more processed it and thought about it, I understood. So what I think happened is that my emotional bank was empty. I think I was emotionally drained just going to work from everything happening around us. but also because lots of demands on my time outside the work. I was just overextended, overcommitted. I was responding to every single text page, whoever needed, whatever they needed. I would try to fix it and help them and stuff like that. So I really did not prepare to go in the evening shift. Evening shift was just one of that additional responsibilities that I had and that I just did. And I did a great job. I took perfect care of my patients. I provided the best care possible. But I think it kind of did leave a room to be emotionally affected more. It kind of hit me straight in the heart. And I didn't expect that. It surprised me. And I think that happened to lots of us, especially now during this pandemic, dealing with everything medically, but also with all these emotional kind of overlays that are going on now too. And as I was thinking more about that, I came up with an analogy. I think that what happened is like driving a car at night
Mhm.
and hitting a black ice patch.
Mhm.
You're driving and you lose control of your car. It
Mhm.
is not going where you want it to go. Your car steers you through it and you
Yeah.
somehow end up, coming back on the road and it feels like you had accident. You didn't have accident, but it feels like you had accident.
Mhm.
So that was the similar feeling, I think, that kind of working in that clinical arena, something affects you emotionally very powerfully. You don't know why, but it affects you. And that surprised me. I was like asking why. And I think that emotionally, that is what happened, as I said, to many of us going through the pandemic. So yeah, it's very extremely difficult times on lots of different levels.
Now, you wrote that article back in
Mm-hmm.
July, and we're
Yes.
speaking
Uh-huh.
now in the second week of December,
Yes.
and we're in
Yes.
the midst of pretty much the worst wave of the
Yes.
pandemic.
Yeah.
And you're so right in that a lot of clinicians I talk to, especially on this podcast, they are
Mm-hmm.
feeling the emotional strain, and that is taking away from the compassion and the empathy.
Mm-hmm.
So, my
Yeah.
question is, what kind of advice can you give to
Mm-hmm.
these physicians who are getting emotionally drained, especially during the worst wave of the pandemic, that can affect how they empathize and care for patients? Can you share anything from your experience that can help these doctors?
Oh, absolutely. Well, the first thing is you cannot run on an empty tank. You have to have your emotional bank full. You have to make time to take care of yourself. You need to make time to sleep. You need to make time to exercise, have a good nutrition. You also need to set limits of what you can and you cannot do. You need to probably also, much more than ever, you need to prioritize
Hmm.
what is important, what is not important. In general, I think healthcare workers are helpers, they're givers, they're fixers, and we want to kind of be there for everybody and help everybody. But that is really hard because there are just so many demands of our time. And as you said, this time is also so emotional. People are getting drained. You just need to make extra effort to take care of yourself. Another one, maybe, and that would be kind of one of the lessons that I learned too, is that it is very important to take time and process your emotions.
Hmm.
We do not talk often about that. I think we often suppress them. So instead of suppressing them, take a time, pause, stop, reflect, share. If you're happy, be grateful for it. If you're sad, if you're angry, if you're fearful, that is okay. It's
Hmm.
very, very important that we start talking more about those emotions instead of sweeping them under the rug. If you sweep them under the rug, they're going to create a bump and you might fall over it and they might raise even uglier head and make things even more and more difficult. It's like being accumulated. So at the end, all these emotions, it might be enough to just have one extra little drop on a full cup, and then you just lose it. You can't do it anymore. So I think expressing emotions is extremely important. And as I wrote in my article, unexpressed emotions never die.
Hmm.
They're there with you. And how do you work through it? I think it all depends on a person.
Sure.
Some people talk, some people like to be alone, some people exercise, some people cook, some get a therapist or a friend or somebody to talk to. So there are different ways, but it's very, very, very important, I think, to stop, take time, and reflect and process what is happening.
We are talking to Jasminka Criley. She is a hospitalist and she wrote the Kevin MD article, The Emotional Side of Being a Doctor During the COVID-19 Pandemic. Jasminka, what is your take-home message that you want to leave with the Kevin MD audience?
My take-home message, it's probably that it is very important that as a physician, you cannot do it all.
Hmm.
You cannot save the world. No one can. So you do what you can, when you can, whatever you can, the best you can, but also at the end of the day, make sure to take care of yourself. Self-care is extremely important. It is not selfish. It is important. Another thing that goes along with the self-care is also making sure to get enough sleep. I can tell you, Kevin, more about my interest in sleep, but sleep is extremely important. When I started working on a sleep, that actually all started as my medical murder mystery, the sleep mystery class workshop. It was just extremely, extremely popular. And then afterwards, I got an NIH award to create a digital game
Hmm.
that had to do with the sleep mystery. And as the more I was learning about sleep, the more I was surprised how much I didn't know what healing power sleep had. Sleep is important for our emotional health, for our physical health, for our mental health. If you sleep better and you get adequate number of sleep, you are reacting better, you're less anxious, there is less ADHD, there are less accidents, there is a benefit for your long-term health as well. There are less chronic diseases if you sleep better. So sleep is just extremely important and you need to prioritize that. I do have to share that, and you know that doctors are not as good in taking care of themselves.
Hmm.
And they're also not good in sleeping.
Hmm.
Our boys did a science research. They were looking at how much people sleep in different professions, and they found out that even pre-COVID, doctors were sleeping less than other professions.
Hmm.
So I think just as a profession, we really need to emphasize that one way of taking good care of yourself is having a good sleep.
Jasminka, thank you so much for sharing your time and insight. And thanks again for being on the show.
Okay, you're very welcome, Kevin.